Hello and welcome to Pregnancy Info. In the last video, we have told about infertility in females. In the current video, we will discuss about the infertility in males. But you have to understand what is infertility. Infertility is when you have trouble getting pregnant or staying pregnant. Fertility problems can happen in women and men, and there are many causes of these problems. Male infertility is any health issue in a man that lowers the chances of his female partner getting pregnant. About 13 out of 100 couples cannot get pregnant with unprotected sex, and there are many causes of infertility in men and women. In over a third of infertility cases, the problem is with the man. This is most often due to problems with his sperm production or with sperm delivery. Common signs or causes of infertility in men. If a man feels testicle pain or swelling, which was not before, it can lead to infertility in his life. Problem maintaining erection. A man's ability to maintain an erection is often linked to his hormone levels. Reduced hormones may result, which could potentially translate into trouble conceiving. Issues with ejaculating. Similarly, an inability to ejaculate is a sign that it might be time to visit a doctor. Small firm testicles. The testes house a man's sperm, so testicle health is paramount to male fertility. Small or firm testicles could indicate potential issues that should be spotted by a medical practitioner. Sperm disorders. The most common problems are with making and growing sperms. Sperms may not grow fully, be oddly shaped, not move the right way, be made in very low number, or not be made at all. Sperm problems can be from traits you are born with. Lifestyle choices can lower sperm numbers. Smoking, drinking alcohol, and taking certain medicines can lower sperm numbers. Other causes of low sperm numbers including long-term sickness such as kidney failure, childhood infections such as mumps, and chromosome or hormonal problems such as low testosterone. Damage to the reproductive system can cause low or no sperms. About 4 out of every 10 men with total lack of sperm have an obstruction or blockage. Varicolceles. Varicolceles are swollen veins in the scrotum. They are found in 16 out of 100 of all men. They are more common in infertile men, 40 out of 100. They harm sperm growth by blocking proper blood drainage. It may be that varicolceles cause blood to flow back into the scrotum from your belly. The testicles are too warm for making sperm. This can cause low sperm numbers. Immunological infertility. Sometimes a man's body makes antibodies that attacks his own sperms. Antibodies are most often made because of injury, surgery, or infection. They keep sperm from moving and working normally. We don't know yet exactly how antibodies lower fertility. We do know that they can make it hard for sperm to swim to the fallopian tubes and enter an egg. This is not a common cause of male infertility. Obstruction. Sometimes sperms can be blocked. Repeated infection, surgery such as vasectomy, swelling, or developmental defects can often cause blockage. Any part of the male reproductive tract can be blocked. With a blockage, sperm from the testicles can't leave the body during ejaculations. Hormones. Hormones made by the pituitary gland tell the testicles to make sperms. Very low hormone levels cause poor sperm growth. Chromosomes. Sperm carry half of the DNA to the egg. Changes in the number and structure of chromosome can affect fertility. For example, the male Y chromosomes may be missing parts. Medications. Certain medications can cause sperm production, change, function, and delivery. These medications are most often given to treat health problems like arthritis, depression, digestive problems, infections, high blood pressure, and cancer. Injury to the scrotum and testes may also be the cause of infertility in males. Overheated testicles from wearing clothing that's too tight or swimming or bathing in hot water often and recently find that it is the cause of infertility. Diagnosis. Cause of male infertility can be hard to diagnose. The problem are most often with sperm production or delivery. Diagnosis starts with the full history and physical examination. Your healthcare provider may also want to do blood work and semen tests. First thing he will do is history and physical exam. Your healthcare provider will take your health and surgical histories. Your provider will want to know about anything that might lower your fertility. These might include defects in your reproductive systems, low hormonal levels, sickness, or accidents. Semen analysis. Semen analysis is a routine lab test. It helps show the cause of male infertility. The test is most often done twice. Semen is collected by having you masturbate into a sterile cup. The semen sample is studied. It can be checked for things that help or hurt conception or fertilization. Transrectal ultrasound. Your healthcare provider may order transrectal ultrasound. Ultrasound uses sound waves bouncing off an organ to get a picture of the organ. A probe is placed in the rectum. It beams sound waves to the nearby ejaculatory ducts. The healthcare provider can see if structures such as the ejaculatory duct or seminal vesicles are poorly formed or blocked. Testicular biopsy. If a semen test shows a very low number of sperm or no sperm, you may need a testicular biopsy. This test can be done in an operating room with general or local anesthesia. A small cut is made in the scrotum. It can also be done in the clinic using a needle through the numb scrotal skin. In either case, a small piece of tissue from each testicle is removed and studied under a microscope. The biopsy serves two purposes. It helps find the cause of infertility and it can collect sperms for use in assisted reproduction. Hormonal profile. The healthcare provider may check your hormones. This is to learn how well your testicles make sperms. It can also rule out major health problems. For example, follicle-stimulating hormone is the pituitary hormone that tells the testicles to make sperm. High levels may mean your pituitary gland is trying to get the testicles to make sperm, but they won't. Treatment. Treatment depends on what's causing infertility. Many problems can be fixed with drugs or surgery. This would allow conception through normal sex. The treatment below are broken into three categories. Number 1, non-surgical therapy for male infertility. Number 2, surgical therapy for male infertility. Number 3, treatment for unknown cause of male infertility. You have to find out the problem. Women may carry the baby, but it takes two to tango. 20 to 30% of infertile couples discover fertility factors on the male side. Another 40% find infertility factor on both sides. Another things you need to know, male infertility rarely has symptoms that are observable without a semen analysis, which is a test that measures the health of the semen and sperms. When you do see the doctor, make sure you are both tested. So, before your own treatment, show your male partner reports to the doctor or try to assist with him to go to doctor. I hope you can understand the all causes and problems related to male's infertility. If you like the video, then share it with your family members, friends, and the people that want to know about this problem. To encourage me, subscribe my channel. Thank you.